Namaste, my name is Dr. LAKSHMAN. I'm a consultant surgeon at the JAYADEV Memorial Rashtrotthana Hospital and Research Center. I thought I would share some basic facts about gallbladder stones with you. The gallbladder stone disease is a very common entity that general surgeons see. It usually presents with severe abdominal pain and sometimes associated with vomiting. The pain in the upper part of the abdomen may be felt in the back between the shoulder blades and can also be felt in the right shoulder. But of course, this is a classical presentation. Gallstones can present in various other ways. Sometimes you may feel the pain in the left side of the abdomen in the upper part. Sometimes it may just present as general indigestion. Usually these discomforts are worse after eating, particularly a heavy meal or a fatty meal. So when you come with these symptoms, the surgeons would normally ask for a blood test and an ultrasound scan of the abdomen. Blood tests take the form of routine counts, liver function tests, kidney function tests, and blood sugar is checked as a routine. Ultrasound is a sensitive tool in diagnosing gallbladder disease. It can tell us several things about the stone and its possible complications. We should remember that gallstones initially present just as pain, a phenomenon called a biliary colic, but it can also present with complications. Complications are several, but the main ones I would like to share with you here now. If the mouth of the gallbladder is blocked, then the gallbladder can become highly enlarged or distended, and bile inside can get infected, a condition called empyema of the gallbladder. The stone may shift from the gallbladder into the adjacent area, a tube connecting the liver with the small intestine, the beginning of the small intestine, an area called the duodenum. If the stone shifts to that area, it is possible that you may end up with an infection of the bile, a condition called cholangitis, and you may also have an obstruction to the flow of bile, which leads to jaundice, and finally one of the serious complications, a complication of inflammation of the pancreas gland called pancreatitis. It is wise to deal with gallstone disease even before all these complications arise. The time-tested gold standard treatment for gallstones is removal of the gallbladder. Many times people come and ask for tablets and other kinds of medicine to avoid surgery. But I would strongly recommend that without hesitation, one should go for the removal of the gallbladder when it has stones. The next common question is, will the body not miss the gallbladder if it's removed? The answer is a straightforward no. Bile, which is a digestive juice, continues to flow from the liver where it is generated into the small intestine through the bile duct, and digestion takes place without any hindrance. In fact, many times when there are stones in the gallbladder, it will not be a functioning organ. The function of the gallbladder is to store bile, and this is not an essential function. So even if you remove the gallbladder because of the stones, digestion will continue to take place normally. Next, a few words about the surgery. Surgery for gallbladder stones, which is, as I said, removal of the gallbladder, is through a minimally invasive procedure called laparoscopy. We make about 4 holes in the abdomen, each hole about 10 millimeters and 5 millimeters in size, and look at the inside organs with a telescope, and the image from the telescope is transmitted through a video camera onto a screen. So we look at the screen and do the necessary operation of removal of the gallbladder. It is done under general anesthesia. Hardly any pain is felt, And because we don't have a cut on the abdomen, on the tummy, it is seen that these patients hardly feel any pain in the post-operative phase as well. They go home the next day with minimal or no restriction in food, that is diet or activity. It is generally a safe operation, and complications which may occur are extremely rare. I repeat, complications are extremely rare, and these may include bleeding, infection, and a phenomenon called bile leak. But I repeat it a second time, one should not be afraid or apprehensive about complications. The complications of leaving the gallstones behind and not dealing with it are much higher than the rare complications that one may see after surgery. Hence, surgeons without hesitation recommend removal of the gallbladder when there is gallstone disease. I hope this has clarified a few issues you have about this. If you have any questions, feel free to contact the hospital, and one of us will be happy to answer those questions. Thank you very much.
ರಾಷ್ಟ್ರೋತ್ಥಾನ ಆಸ್ಪತ್ರೆಯು 160 ಹಾಸಿಗೆಗಳ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಯ ಮಲ್ಟಿ ಸ್ಪೆಷಾಲಿಟಿ ಹಾಸ್ಪಿಟಲ್. ಅಂದರೆ ಒಂದೇ ಸೂರಿನಡಿ ಆಧುನಿಕ ವೈದ್ಯಕೀಯ ಪದ್ಧತಿ, ಆಯುರ್ವೇದ, ಹೋಮಿಯೋಪತಿ, ಯೋಗ ಮತ್ತು ಪ್ರಕೃತಿ ಚಿಕಿತ್ಸೆಗಳನ್ನೊಳಗೊಂಡ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಗಳು ಇಲ್ಲಿ ಲಭ್ಯವಿವೆ. ಅತ್ಯಾಧುನಿಕ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ, ಉತ್ತಮ ತಂತ್ರಜ್ಞಾನ, ತಜ್ಞ ವೈದ್ಯರು ಹಾಗೂ ಇತರ ವೈದ್ಯಕೀಯ ಸಿಬ್ಬಂದಿಗಳನ್ನು ಈ ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. 19 ಜನರಲ್ ವಾರ್ಡ್ಗಳು, 72 ಸೆಮಿ ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳು, 11 ಎಮರ್ಜೆನ್ಸಿ ವಾರ್ಡ್ಗಳು ಹಾಗೂ 17 ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳಿಂದ ಕೂಡಿದ ಸಮಗ್ರ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ ಇಲ್ಲಿ ಲಭ್ಯವಿದೆ. ಮುಂದಿನ ದಿನಗಳಲ್ಲಿ ಬಡ ರೋಗಿಗಳ ಬೆಂಬಲಕ್ಕಾಗಿ ದಾನಿಗಳ ಸಹಾಯದಿಂದ ನಿಧಿಯೊಂದನ್ನು ಸ್ಥಾಪಿಸುವ ಗುರಿಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಜೊತೆಗೆ ಹತ್ತಿರದ ಸ್ಲಂಗಳಿಗೆ ಹಾಗೂ ಹಳ್ಳಿಗಳಿಗೆ ಹೋಗಿ ಉಚಿತ ಆರೋಗ್ಯ ಸೇವೆ ನೀಡುವ ಯೋಜನೆಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಆರೋಗ್ಯ ಸೇವೆಯನ್ನು ಅರಸಿ ಬಂದವರಿಗೆ ಮಾನವೀಯ ಮೌಲ್ಯಗಳೊಂದಿಗೆ ಆರೈಕೆ ನೀಡುವುದು ಮತ್ತು ಉತ್ಕೃಷ್ಟ ಗುಣಮಟ್ಟದ ಚಿಕಿತ್ಸೆ ನೀಡುವುದು ಆಸ್ಪತ್ರೆಯ ಆಶಯ. ಎಲ್ಲರೂ ರೋಗಗಳಿಂದ ಮುಕ್ತವಾಗಿ ಆರೋಗ್ಯವಂತ ಸಮಾಜ ನಿರ್ಮಾಣವಾಗಲಿ ಎನ್ನುವುದು ಆಸ್ಪತ್ರೆಯ ಉನ್ನತ ದೃಷ್ಟಿಕೋನ.